Hi, Dr. Reagan Robertson, CCO of Productive Dentist Academy here, and I have a question for you. Are you finding it hard to get your team aligned to your vision, but you know you deserve growth just like everybody else? That's why we've created the PDA Productivity Workshop. For nearly 20 years, PDA workshops have helped dentists just like you align their teams, get control of scheduling, and create productive practices that they love walking into every day. Just imagine how you will feel when you know your schedule is productive, your systems are humming, and your team is aligned to your vision. It's simple, but it's not necessarily easy. We can help. Visit productivedentist.com/workshop. That's productivedentist.com/workshop to secure your seats now.
We got John Remmers involved. I talked to John. John came in, and John is a firm believer. Even though he's the one who invented the CPAP, he's a strong believer in oral appliance therapy also. So I began trying all the different appliances that were out there.
Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way. It's just one that has worked extremely well for me, and I'd love to share that with you, so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast.
Hey, it's Dr. Bruce Baird of the Productive Dentist Podcast. I got started doing sleep apnea back, I guess it's been 15 years ago. Before it was like the thing that was going on with everybody, but I got started with it, and I call that physiologic risk. So if you heard me talking on the other podcasts about some of the risk factors I see a lot of erosion, and I see bruxism on these patients. So it's something that has become a big part of my practice. I'm somebody who has severe sleep apnea, and I had a guy who was considered the grandfather of sleep medicine or sleep dentistry, became good friends with Ed Spiegel. Ed passed away a few years ago, and John Remmers. John Remmers did the first polysomnogram in the world, in the U.S. He is when you see REM star with the different types of CPAPs, John was the man behind it, and so When I wanted to learn about sleep apnea, I had both those guys come to my office. I wanted to learn it from who I considered to be the best, and I've done that in almost every aspect of dentistry. I feel like I went to Pete Dawson. Pete was, in my opinion, when I was learning restorative, I just felt like he was the best. John Coyce, the best. There's a lot of the best, but it's Carl Misch with implants, Mike Picos with grafting, and you just go down the list. But I wanted to have Ed come in. So Ed came in, and we were going to do some home recordings using a Remmers recorder. And one of the patients didn't show up. And so I said, well, I know I snore, so why don't we test me? And I'm somebody who had already had what they called idiopathic cardiomyopathy, which is an enlarged left ventricle. And my ejection fraction was down just above 37 or 38, which a healthy male at my age, I was 39 years old, probably should have an ejection fraction in the high to mid 60s. That means how much blood's coming out of that left ventricle. So anyway, our patient didn't show up. So I said, well, I'll do it. I know I snore. So I took the recorder home, and the next day we did the results of the recorders. And one of the patients who showed up, they had mild to moderate apnea. I think they were stopping breathing 13 times an hour. Then we tested, they pulled my stuff down. I was stopping breathing 33 times an hour. My pulse was going to 180 beats a minute. And my pulse ox would drop to 62%. Well, you can't hold your breath and get to 62%. I can tell you pretty much straight up, you'll pass out before you do. So all night long, I'm doing this, gasping for air, clenching, not so much bruxing, but sleepy in the daytime. I had all the signs and symptoms. So we got John Remmers involved. I talked to John. John came in, and John is a firm believer, even though he's the one who invented the CPAP, he's a strong believer in oral appliance therapy also. So I began trying all the different appliances that were out there from the, Keith Thornton has developed the TAP appliance. There's the TAP 2, the TAP 4, the TAP whatever. I tried 3 or 4 of the different TAPs. I tried EMA. I tried a bunch of different attachments and a bunch of different appliances. And what I found most comfortable for me was the Somnodent. There's several others that are kind of knockoffs of that now. So that was comfortable because I could actually separate my teeth. I didn't feel like I was locked in. So I began wearing this oral appliance therapy, and it tended to do very well for me for a while. And then I started having TMJ problems. We opened the bite a little bit. I still had TMJ problems. And so I was to a point to where I was like, this is hurting my jaws. It's changing my bites significantly. And I've done hundreds of oral appliances that it doesn't bother the patient at all. But for some reason, it really affected me. So my option 2 was, I think I'll go have surgery done. So I went, my buddy is a surgeon and pathologist and just a super guy. And he said, well, we can do a geniotubercle advancement, which means I can move my jaw, my lower chin forward where my attachment, my tongue, and it would pull my tongue forward. Also, we'll do a palatal resection. We'll do a tonsillectomy. We'll do a nasoplasty. And I told him, while you're in there, just take off all my buccal tori because I'm such a clencher. I had huge buccal tori. I remember I'm biting at 1,000 pounds per square inch. So he said, well, Bruce, I think we ought to at least do this over 2 visits, maybe even 3. And I was like, nah, you're going to get one shot at me. So 6.5 hours of surgery. I think I lost 25 pounds after that surgery. It was miserable. And within 6 months, I was snoring and still had apnea. So having said that, I said, well, I guess nothing's going to work for me. And by golly, I'm not wearing one of those masks. I'm not going to wear the CPAP because I just don't want to wear it. And I was actually a 10% owner in a sleep lab here in my hometown. So that I didn't wear anything for 1.5 years. And all of a sudden, I went to see my dad when he was living over in a small town called Mineral Wells, Texas, where I grew up. And I'd gone over and I was drinking probably, 4 liters, 5 liters a day of Diet Coke because I was sleepy all the time. But on the way back from Mineral Wells, one morning I ran off the road. I fell asleep and kind of scared me because I didn't kill myself. I didn't kill anybody else, but it really scared me. I was falling asleep at Sonic Drive-In when I would order a drink. It would take them like 30 seconds to get it out there. I'd already be asleep. I remember one time my assistant, Summer, Carol, was sitting with me and I'm designing a CEREC crown. And guess what? I fell asleep designing it right in front of the patient. Summer said, hey, Dr. B. And I went, oh, yeah, okie dokie. I literally was dozing off. I could sit in a chair, fall asleep. I just wasn't exercising. I felt lousy. It was just a tough, really, really tough time for me. But that fall running off the road was significant. I got home, I told my wife, and she said, we're going to get you a CPAP. And I got a CPAP, and I've been wearing it ever since. My ejection fraction now is back up to mid-50s. I don't have cardiomyopathy anymore. My blood pressure is normalized. My weight has dropped by 30 pounds from and I've done nothing different except now I'm breathing at nighttime. And the look and the appearance and all that stuff, I just tell my wife I'm Tom Cruise and I'm requesting a flyby. So I've got my little mask on. I do a full mask. I know some people use nose pieces or whatever. I'm just telling you. And the reason I'm telling you this is because there's no one set solution. I don't want you to just be, oh, I'm the oral appliance guy and I make these for physiological risk patients that have apnea. I was on the Reggie White Foundation. I actually went to his induction in the Hall of Fame ceremony years ago, and Sarah White, his widow, I got to know her very well, and the treatment of apnea, I don't care what it is, but we got to help people. We've got to be able to help folks, and so get your training. I think Kent Smith does a fantastic course in the Dallas-Fort Worth area. It's called Wasted Days and Sleepless Nights, or something like that. And Meghna Dasani down in Houston is doing a fantastic course. She's a productive dentist. Both of them have been through PDA numerous times, which is a course that we teach some of these things. But go to a course, get educated about it, but understand that there's not one solution. The other thing that kind of drives me nuts is I know, when you have kids, when they're tired and they're sleepy, how do they behave? Well, usually they're little buttheads. Well, I was a little butthead as a kid because I had ADD, ADHD, still have it. Not as severe because I'm sleeping better. But ADD and ADHD is a sleeping disorder, probably 90% of the time. Now, I will say I have a daughter, my oldest daughter, her daughter, I have a granddaughter who actually has central apnea. She stops breathing, and so she has to wear a monitor 24/7. She's now 5 years old, still wearing the monitor. We're hoping she'll grow out of it. But so some people do have central apnea, but obstructive sleep apnea, if you think of these little kids, they all look the same. They've got a runny nose, which I had. I'd have a wrinkle on my nose from, snot coming out of my nose all the time and wiping my nose all the time because I had allergies. Those allergies, when you're not breathing through your nose, you're not getting something called nitric oxide, which really is necessary for facial growth and development. So you have to have that. And these kids, they've got allergies, they've got tonsils, they've got adenoids, they can't breathe. Now, back when I was growing up, people had their tonsils out routinely. I didn't, interestingly enough. And that caused me to have some pretty significant sore throats. And now they say, oh, you got to have 10 positive strep tests before an insurance company will pay for it. Well, I don't give a crap about insurance companies. If your child or somebody you know or one of your patients, if you see kids, they come in and they got that little look with the, maybe it's retrognathic, maybe the upper is not developed, maybe there's, but start thinking, do you have allergies? But I have more docs after I talk about this at our seminars, and more teams come up to me and say, oh my gosh, my kid's just like that. My grandkids, kind of one of their prerequisites is they got to have their adenoids and tonsils out. And even the ENT guys, I've got a couple of guys I send to pediatric ENTs that just know me, and they're going to take care of it, get it done. And they'll write reports for whatever. But you get these kids, and they did a study back years ago where the kids that had their tonsils removed, that had been diagnosed with ADHD, went from the bottom quarter of their class to the top quarter of their class in 6 weeks. Why is that? Because they're not sleeping. One of my grandkids was sleeping over. He was 3, or he is 3. He's snoring like a freight train over there. Look back in the back of his throat, he's got these big tonsils. Well, guess what? He's getting ready to have his tonsils and adenoids out. So anyway, I bring that up also because it's not just about adults. It's not just about us. It's about kids too. And it's something that I had one mom come up to me, and she was crying up front. And she said, I wish I'd have heard this information 2 years ago. My daughter had ADD and ADHD, and graduation, she had left, she had gone to a party, was not drinking, and she fell asleep and hit a tree, and she passed away. And she said, I wish I would have known this information beforehand, because she was always tired all the time. So, I take it pretty serious. And, all I did was I hugged the mom. I said, man, I'm sorry. I wish I would have been able to get that info to you earlier. But every single patient that comes in my office, we go through the risk factors with them. And I almost always say something about kids too. If you have any grandkids that has this, you really have to have them evaluated. Why? Because that's above and beyond. That's above and beyond the call of duty. Why do I want to do it? Because it makes a difference in people's lives. And that, to me, is more important than putting a crown on a tooth or putting a filling in a tooth. To me, it's more important. So I share that information with you, and hopefully it'll make a difference to somebody you love, grandkids, kids. But I'm telling you, when a kid's sleeping good, man, it just changes everything about them. So anyway, send me any questions to bruce@productivedentist.com. Sign up on iTunes for our podcast. And I look forward to our next podcast. See you soon.
Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.